A pulmonary embolism, PE, is a potentially life-threatening medical condition that occurs when a blood clot, typically from a deep vein in the legs, known as deep vein thrombosis or DVT, travels through the bloodstream and lodges in the pulmonary arteries in the lungs. This obstructs blood flow to a portion of the lung, leading to various symptoms and potentially severe complications. Here is an overview of pulmonary embolism. 1. Causes. The most common cause of pulmonary embolism is a deep vein thrombosis, DVT, where a blood clot forms in a deep vein, often in the legs. Other causes can include clots that form in other parts of the body, such as the pelvis, arms, or heart, and then travel to the lungs. Risk factors for PE include prolonged immobility, surgery, trauma, certain medical conditions, like cancer, pregnancy, and the use of birth control pills or hormone replacement therapy. 2. Symptoms. Symptoms can vary in severity and may include sudden shortness of breath, chest pain, typically sharp and worsens with deep breaths or coughing, rapid heart rate, coughing, often with bloody or bloody-tinged sputum, feeling lightheaded or dizzy, sweating, leg swelling if associated with a DVT. 3. Diagnosis. PE is diagnosed through a combination of medical history, physical examination, and various diagnostic tests. Common tests include chest CT angiography. This is the most common and definitive test used to diagnose PE. D-dimer blood test. Elevated levels can suggest the presence of a clot but are not definitive. Ventilation perfusion, V/Q, scan, an alternative to CT angiography for some patients. Ultrasound, used to detect DVT in the legs. 4. Treatment. Prompt treatment is essential to prevent complications. Treatment options include anticoagulant medications, blood thinners. These are usually the first-line treatment to prevent the clot from growing and to prevent new clots from forming. Thrombolytic therapy. In severe cases, clot-busting medications may be used to dissolve the clot quickly. Embolectomy. Surgical removal of the clot may be necessary in certain cases. Inferior vena cava, IVC, filter. A filter may be inserted to prevent clots from traveling to the lungs in individuals who cannot take anticoagulants. 5. Complications. If left untreated, a pulmonary embolism can lead to serious complications, including heart strain, respiratory failure, and death. Long-term complications may include post-thrombotic syndrome, chronic pulmonary hypertension, and recurrent clotting episodes. 6. Prevention. Preventing PE often involves addressing the underlying risk factors. Strategies may include staying active and avoiding prolonged periods of immobility, using compression stockings, medications to prevent clot formation in high-risk individuals. Pulmonary embolism is a medical emergency, and immediate medical attention is crucial. If you or someone you know experiences symptoms suggestive of a pulmonary embolism, seek medical help right away. Early diagnosis and treatment greatly improve the chances of a positive outcome. This overview is meant to provide general information. Always consult with a healthcare professional for specific guidance and treatment options.